So today's topic is going to be on the updates that we're seeing about CCCA. Hi, my name is Dr. Nina, and on my channel we talk about health-related conditions as well as hair loss. CCCA, if you're not familiar, is an inflammatory form of alopecia. It is an epidemic right now in the Black community amongst Black women. However, we are seeing cases where men are coming up with CCCA as well. All right, so let's talk about some of the things that we're seeing in the clinic and also some topics that have come up in conferences with CCCA. So number one, the great thing is that there were some studies that was done with metformin, and metformin topically has been shown to help with the inflammatory factors of CCCA. This is huge. So this is a great advancement in the medical industry. This is actually one that I'm kind of excited for and happy. I took a look at the studies and I can honestly say that everything makes perfect sense. It makes more sense using the topical metformin than taking the metformin orally, which I am not a fan of. So if you are working with a dermatologist and you have CCCA, I would definitely mention the topical metformin. You may benefit from it as well. Number two, we are getting great results with CCCA with a diet change. And when I talk about diet, we are talking about eliminating gluten from the diet, limiting the intake of red meat, and also dairy, and of course, what most of us love the most, sugar. And the reason for this is that we found, since CCCA is an inflammatory alopecia, now when you start to suppress the inflammation in the body or have less inflammation, some of those symptoms that you are experiencing tend to go away, such as the tenderness, the itchiness on the scalp, and also the excessive shedding. Try it out. If you're not working with a nutritionist, a dermatologist, or someone in the medical industry, you can contact us and we'll be more than happy to help you get on an anti-inflammatory suggested diet. But as far as results, it definitely helps. I have had clients that would say that their scalp was burning or excessive itching, and as soon as they cut those foods out, we were able to calm down the inflammation. Okay, so when you have CCCA, it's very crucial to get some blood work. And the reason for that is that if you have blood work, then we are able to help you. For example, there are some connections with an increase in high hemoglobin A1C. So if you're not familiar with hemoglobin A1C is, so it is one of the markers that's used to determine if you are pre-diabetic. So we take a look at your A1C, also insulin. So a lot of times, some women who have PCOS, which is high androgen hormones, their insulin tends to spike. When you have CCCA, and if you have a spike in your insulin, as well as the high hemoglobin A1C, the elevation in these numbers can also hinder your progress. However, we are seeing that once we start to get these markers down, then we can actually help revitalize the hair follicle, and you will start to see hair grow in those areas, as well as calming down the inflammation. When you have high cholesterol levels, we're also seeing that these things can exacerbate the hair loss, but getting those numbers under control, then we're able to slow down the progression of this disease. Also, with your cholesterol levels too, if you know what those numbers are, then if they're elevated, then a professional can actually help you get those numbers under control. When there's an elevation in cholesterol levels, when you are producing sebum, the sebum is toxic to the follicle. So that in itself can cause the CCCA to accelerate. So all of these conditions inside of the body is so crucial as far as getting them in range so that you can get results. And people are getting results. Like we're seeing the numbers go down and we're actually seeing hair growth. So all of this is exciting. We just got to get you to get some updated blood work, or actually go and get some blood work and draw the connections between, okay, I'm experiencing hair loss, but I also need to see what's going on the inside, because there could be a correlation between the two. Okay, so I get asked this question a lot. Well, I have CCCA, and what type of hair style can I get? So 2022 update on hairstyles for CCCA. We have clients who are still able to get treatments with knotless braids, and so knotless braids is a feed-in under method of braids. The professional that's doing it, the braids shouldn't be tight. So that's not how knotless braids work. If they're done correctly, and if you have CCCA and it's not progressed, that is a style that you can get and you can still receive treatments. Of course, you want a good quality wig. The better the laces, the more comfortable it's going to feel on the scalp. and a wig that you can take on and off. You don't want to put any type of glues or adhesives on the scalp. Headband wigs is perfect. So out of the two, we're looking at knotless braids or we're looking at the wigs. It's so important not to get hairstyling advice from someone who is actually not practicing doing hair. So if the person is not a cosmetologist, or if the person is not a specialty in that field with the type of hairstyle you're wanting, then I would not seek advice. And this also goes for medical professionals, because I am seeing where certain professionals are telling women who have CCCA that it's okay for you to get the crochets, and that is not. If you don't want your CCCA to accelerate, then that's one hairstyle you would want to stay away from. It's something about the hair with that particular, the crochet hair, it's very acidic. And I've seen cases where some clients, had a dime size of hair loss, and when they took that hairstyle out, it just started to spread. So knotless braids, if it's done correctly, and a wig that you can take on and off, that's the only two type of hairstyles that I would suggest besides wearing your own hair. Okay, and the last thing that's on the list as far as updates and treatments that's really working. So earlier I mentioned the topical metformin, but there are also natural treatments that's very effective as well. So if there is inflammation and it's under control, then PRP is another form of treatment that has been beneficial for some. At our clinic, we do PRP, but we're very careful about doing PRP. We want to make sure that the inflammation is under control and is not active. We are getting great results with mesotherapy. So if you're not familiar with mesotherapy is a form of a cosmeceutical. And in this cocktail, there is many different types of peptides. There are some great studies that's taking place right now with peptides actually helping with various forms of hair loss. And CCCA is one of them, especially with the scarring. Now, there are new cases where some doctors are starting to see hair pop up in areas where scarring was once at. So we still treat those areas. And we're using amino acids, vitamins, and these different types of peptides and tripeptides on the scalp. Internally, the vitamins is going to be crucial. When you are trying to revitalize a follicle, sometimes a multivitamin, you need more because you're only getting small amounts in a multivitamin. So we give you a therapeutic form of a vitamin A, different type of anti-inflammatories, DHT blockers. So it just all depends on what your body needs, and they're customized. So if you have CCCA and your sister have CCCA, you guys' treatment may not be the same. You may have two totally different type of treatment protocols for your condition. If you have CCCA or know someone that have CCCA, please share this video, like and subscribe, and until next time, take care.